Hi, church family. I just wanted this opportunity to try to connect with you in the best way possible during these seemingly unprecedented times. That's really the word I hear associated most often with the accommodations, adjustments, and actions resulting from the COVID-19 coronavirus pandemic. Certainly it is unprecedented to this present generation, but it rings familiar for one particular entity, the church. In the midst of epidemics, pandemics, plagues, and mass hysteria, the church has a long history of finding herself at ground zero as a presence of hope, peace, care, and ministry. From the Cyprian plague back in 250 AD to the Antonine plague in AD 165 to recurring pandemics of the bubonic plague, the church was noted for her service of benevolence to, as the pagan Emperor Julian wrote, not only to their own poor, but ours as well. As pastors have struggled in recent days with decisions affecting both congregational and community well-being, determining whether to assemble or not to assemble, all the while posting our well-prepared and thought-out statements for social media, our collective conscience recognizes how these responses stand in stark contrast to past responses in church history. However, what is unprecedented for our page in history is the fully professionalized healthcare system in which modern pandemics occur. With today's understanding of the germ theory of disease, the currently accepted scientific theory for many diseases, one's willingness to charge the front lines of battle with a cold compress is not only unnecessary, but also foolish and problematic. For such a time as this, the best application for the church's golden rule ethic is to follow the universally prescribed dictates of established health authorities such as the Centers for Disease Control and Prevention, the World Health Organization, and local healthcare providers. To truly be of greater service to our fellow man and the healthcare community, we might do well to practice the first dictate of the physician's Hippocratic oath, do no harm. This task is best accomplished by good hygiene and social distancing. Desiring to be exemplary community partners and supportive of the directives set forth by city officials, please make note of the following. Sunday worship will be online only until further notice. The live stream will begin at 11 o'clock a.m. I encourage you to not just turn it on as background noise, but to watch and engage. This blended service can be viewed at our website, our church website, firstlubbock.org, or Facebook Live, or even our First Baptist Church app. All church activities also will be canceled until further notice. Even so, the needs of individuals and families continue, and for a great many, even heightened. Therefore, all of our staff will continue to maintain normal office hours and availability. Finally, daily resources will be provided for the spiritual formation of your family. Utilizing the best means of communication, each age group pastor will provide links and or materials from credible resources to help you in your personal discipleship and the discipleship of your family. If you have not done so, you can even sign up now for my daily devotional at bobbydagnall.wordpress.com. What I find most difficult and what I most grieve during these days is that we can't gather together, seeing each other, hugging, shaking hands, laughing together, grieving together, and worshiping our God together. Our coming together is a kind of roll call of who's here and who's not. Who do we need to check up on? Though we don't know when, we look ahead confidently to that day when we will gather again. And what a glorious day that will be. As humankind, we do not do well spiritually, mentally, or physically in isolation. So it's crucial we utilize other ways of staying connected while practicing social distancing. Many of you have asked specifically, how do we pray during these days? And I can offer you some guidelines. I think we need to be praying for researchers and the discovery of a vaccine that this virus might run its course. We need to be praying for the healthcare workers that man the front lines of battle. Also, we need to pray for a great revival, that when we can gather again, and so many having been shaken to the core of their being, there would be a longing and thirst for what only the resurrected Christ can offer. In these unprecedented times, God's people can find confidence and assurance, certainly in the abiding presence of the resurrected Christ, but also in our own history as a people. Both past and present, our burden is to act always, as Jeremiah said, for the welfare of the city. God bless you. I look forward to seeing you again.